And welcome to this edition of ACAP Today for the week of September 28th, 2020. I'm Jason Parent with the Aroostook County Action Program. On today's broadcast, we are going to speak with individuals involved in the upcoming Yellow Tulip Project, but we're also going to talk about the stigma of mental health, not only here in Aroostook County, but nationwide, and how not only the Yellow Tulip Project, but how the work of a county collaborative is happening to help overcome that. But before we get to all that, we are first going to look at the news and information that you can use for this week of September 28th here on ACAP Today. First, we want to share with you that our offices here in Presque Isle and in Holton are open by appointment or by phone or virtually with curbside assistance. Beginning on the 1st of October, we are going to be allowing individuals into the lobby areas of our Presque Isle and Holton Military Street facility, the 771 Main Street Presque Isle facility. But we encourage you, as the banner over the door indicates, and a similar banner will be hung in Holton this week, to please call ahead for service. If we just need to get paperwork from you, we may be able to sneak that in through the window. We will be doing screening for all individuals who enter the building and escorting folks to a meeting room as quickly as possible, but we encourage you to call ahead because we may, in fact, have you stay in your vehicle until we're ready and the room for your appointment is available. So please do know that we are changing that status effective October 1st. Secondly, we are encouraging our community to join us in wearing masks when out in public. All of us here at ACAP are doing that in any of our shared facilities and are encouraging our employees to do that whenever possible when social distancing is not allowed. We also want to share with you that there are adult drive-through flu shot clinics being held throughout Central Aroostook County in the coming month here. The first one gets underway at the Fort Fairfield Community Center this Wednesday. And as you can see there are drive-through flu shot clinics all the way through the month of October put on by both Northern Light AR Gould Hospital and Carey Medical Center. The dates are there for you. Please do contact our office. We have this information. We'll be posting it on our website, but we want to encourage you to take advantage of these opportunities, as that is very much appreciated given all of the complicating factors that we have with COVID-19 as we head into a new flu season. Applications are being accepted through the end of this month for rental facilities. Individuals who have rental facilities are encouraged to contact us. This is for the month of September only at this point, or if you have not applied yet for the program, you can apply for 3 months of back rent if you have not been able to pay your rent due to COVID-19. As of this point, the program will be coming to an end on September 30th, so we encourage you to get your application in. They can be found online at Maine Housing's website, or you can give us a call here at ACAP and we'll help you fill it out online through our staff here at the agency. Our Home Buyer Home Education Program is HomeWorks Home Buyer Education Program is coming up again in October and November, on the 10th of October and the 14th of November. It's a wonderful opportunity to be able to get some great benefits toward the purchase of a home and learn some very valuable information. If you'd like to participate in the courses, please contact Greg Doak. They are all being offered virtually. Greg's information is there on the screen. Our HEAP appointments for the 2020-21 season are all being scheduled over the phone unless the customer otherwise requests to have an in-person meeting, which you can do. But otherwise, you should have received an appointment card in the mail with your appointment information, and we ask that you just sit tight and wait for us to call you. Keep your phone lines open and be by the phone at the time of your scheduled appointment, as we are doing appointments every half hour, and we want to make sure that we get your information in. All of the rest of the documents are handled by mail. We will send information to you and you will return it to us with a free postage envelope so that we can make sure that all of the proper information is in to get you certified for fuel assistance this year. Our Workforce Investment Opportunity Act, or workforce development programs, have adult programs and youth programs for people in Aroostook County. They are also currently offering a national emergency grant to help individuals who have been impacted by substance use disorder or who would like to enter careers to help other individuals in recovery. If you'd like more information on any of these programs, please contact us here at 764-3712 and we will put you in touch with our workforce development team. Workforce Development, speaking of them, are also offering courses in partnership with Maine's Workforce Collaborative across the state to offer some training opportunities right online. There's some of the topics there on your screen. Please look on the event site or give us a call here at ACAP and we'll make a connection for you so that you can see what courses are being offered and hopefully get you in and enrolled in those classes. Again, they're free and all offered via Zoom. And our friends at the Northern Lighthouse, one of whom we're going to be speaking with on this broadcast, are holding open career opportunities. They held one last week and they have 2 more to go this Wednesday and next Wednesday between 10 a.m. and 12 noon. Just stop by their Presque Isle facility on Academy Street and they will interview you on the spot. And speaking of being offered opportunities, the Navigator Assistance Program here at ACAP, one that we've brought up since the COVID-19 pandemic first hit with support of CARES Act funding. So if you are in need of assistance at this time and aren't quite sure where to turn or what services are available for you, give us a call, 764-3721, and we will be happy to work with you to connect you with the appropriate services. And finally, in the news and information you can use, our community coats drive is continuing. This is the rack outside of our 771 Main Street Presque Isle facility. It's take what you need, leave what you can. So if you have any coats that you would like to donate, or if you are in need of a winter coat for the coming season, even though the temperatures are nice and toasty for this time of year today, we know that the cold is coming. Please do consider leaving a coat or taking a coat if you are in need. This is available 24/7 outside of ACAP's 771 Main Street facility. And with that, that's this week's news and information you can use. I am pleased now to welcome to our program 4 guests. First, Julia Macek is the new behavioral health specialist here at ACAP. Julia, welcome to the program.
Thank you. Thank you for having me.
Great to have you. And Addy Beck-Bell coordinates our prevention and wellness programs here at ACAP, a wide range of services. Addy, welcome to the program.
Thank you. Good to be here.
And 2 of our community partners who we're always happy to work with. First, from the Northern Lighthouse, Jen Crandall is the Clinical Director of Outpatient Services. Jen, welcome to your first ACAP today.
Thank you for having me.
And our next guest, a very good friend of ACAP, worked here for a number of years, and we're so pleased to continue our partnership work with her through her work as the Community Health and Volunteer Coordinator at Northern Light AR Gould Hospital, Dawn Roberts. Dawn, welcome to you.
Good morning.
So let me, we're going to talk a little bit about Yellow Tulip today, but I wanted to first, from our behavioral health professionals on the line, Julia and Jen, get an idea from you about why it's important that we help face the challenge of the stigma around behavioral health in our communities and really nationwide. Why is that important, Julia?
Well, it's important that we continue to help individuals and educate our community and recognizing that mental health is, it affects anyone. It doesn't matter, you know, what color skin you may be or your social economic realm, that mental health affects all of us. And the more that we can understand, you know, some of the signs and symptoms of mental health, mental illness, that will also then support those individuals that are experiencing those symptoms and provide that ongoing support and education around, you know, what may be happening for them. And, you know, it's like I oftentimes think about when you, if you are diabetic and you have to take insulin, that's something that's an ongoing piece. When you experience mental health, it's also that ongoing support and treatment that is important to have available for you. And as we continue to see with COVID-19, that a lot of the effects of experiencing this pandemic has also opened doors of individuals having mental health illness, that the more that we as a community can understand the different parts that, you know, different mental illnesses that may be occurring, the more we can support those individuals and help them feel more willing to, you know, share and participate and be part of ongoing things that may be happening in the community. You know, and the stigma has oftentimes just been there where people don't want to talk about it. And the more that we're open and willing to listen to how individuals are thinking or feeling, that gives them that, you know, empowerment that they can share, and they then become more willing and able to participate. And it then brings down those barriers that, they're just like you or I, they just have, another area that they're experiencing similar to somebody who may be diabetic. They're still, needing the support, they're needing the guidance, they're needing the advocacy that anybody else would need as well.
Thank you, Julia. Jen Crandall, in your work that you do with the Northern Lighthouse and overseeing outpatient services, what do you see in terms of the stigma and how that sometimes impacts the positive work that you're able to do?
Well, I think, yes, I agree with Julia wholeheartedly that as stigma reduces, more people will seek the care that they need. And ultimately, that any community is only as healthy as their most vulnerable population. And, when we talk about breaking down the stigma, the idea that your health your mental health is any different than your physical health is a concept that's incorrect, that they are one and the same, they are completely interconnected. The more chronic your mental illness might be or untreated, the more likely you are to experience chronic health issues like diabetes or even cancer. That your physical health impacts your mental wellness as well. And so we can bring that also all around to your social wellness and your participation. And when we talk about workforce development, we know that when you feel productive, you are more likely to feel mentally healthy. So, the idea is breaking this down. Nobody feels weird about going to their doctor for a cold or going to their doctor or their dentist for a toothache. And it should not be any different with seeing your mental health professional. It's a human characteristic that we all have emotional interactions with our body and the world around us. And the more that we accept that, the more we can be open, and the more open we are, the more healthy we can all be.
Jen, I know that the work that the groups that have come together to organize the Yellow Tulip Project, Northern Light AR Gould is one of the two organizations that are really leading this, and Dawn Roberts joins us from there. Dawn, what is the Yellow Tulip Project, and tell us about the efforts to coordinate it here in Aroostook County and why it's so important. I think we've heard from our two behavioral health practitioners why it's important, but why did you get involved, and why is Northern Light AR Gould really promoting this, and what's it all about?
Yeah, so the Yellow Tulip Project is a Maine-based nonprofit, and the mission is to reduce the stigma around mental health illness. It's based out of Portland. It was a young girl named Julia Hansen who started the project when she was 16. She had two friends that committed suicide in 2015 and 2016, and that's when she decided to start this project for hope, to just let people know that this is out there and you need to pay attention to it. So she chose the color yellow because one of her friends' favorite color was yellow, and also the tulip because her other friend's favorite flower was tulips. And also because the yellow tulip is the flower of hope. So that's what it's all about. And so we started this project back in January. So we've been planning for quite a while. So now it's finally time to plant the tulips, and that's the fun part. And I think we have the right people in place for this project because we all work towards the same goals to smash the stigma of mental health. So I think it's going to be great. We have 19 gardens going in, and that's pretty impressive. So it's going to be all the way from Fort Kent, all the way down to Dyer Brook, and everywhere in between is going to be a yellow tulip garden. So in the spring, I think that's going to be pretty impressive for all those gardens to come up.
So Dawn, who do you have participating? What are some of the organizations that you have participating, and what has the response been as you prepare to dig into the dirt this week?
So our original project, we wanted to bring they have a black and white photo exhibit that they have that you can rent. And we originally wanted to bring that here and do like an assembly at the school about mental health, but we had to kind of scale it back a little bit because of COVID. So we still have the right people in place, I think. We have the Northern Lighthouse, we have ACAP, of course, we have AMHC, the city of Presque Isle has sponsored a garden, and the United Way is also working towards this project. They don't actually have a place to plant, but they've been great. They wrote a grant, so we got the money to buy the bulbs and just get it planning. And so I think it's going to be really fun.
All right, and as Dawn pointed out, Addy Beck-Bell, ACAP is one of the participating sites. And I say sites because we have multiple. Tell us about what will be happening at ACAP this week as it relates to the Yellow Tulip Project.
So we have 9 locations that will be involved. We have a site in Caribou, Dyer Brook, Fort Kent, Gouldville, PIRCTC, Region 2, Military Street, Madawaska, and our main office at 771 Main Street. So all those 9 locations will be planting bulbs on October 1st and 2nd this week.
Why is it important, Addy? You've been involved on the coordinating and planning committee of this event. Why, from your perspective, is this so important, and why is it important that ACAP be involved?
Well, the biggest thing is we need to make sure that we're all working together, and ACAP has a lot of different people that work in with us, all the way from any of the prevention to ECE. So we just need to come together and work together as a team. What Dawn had said is it's a hope project, and what ACAP is we have hope, and we have our mission and vision statements that are out there to make sure that people know that we're here to help them with whatever they need. If they need some assistance with mental health, we know where we can go to. We've got partners everywhere. If they need assistance with heating, we can help with that. So basically what Dawn said is that it's a hope project, and we're here for that.
Let's turn to Jen Crandall. Northern Lighthouse is one of the participants as well. We talked about ACAP, Northern Light AR Gould. So why is it important for, obviously, Northern Lighthouse to be involved, and where are you planting tulips?
I wish I knew exactly where we were planting tulips, but I'm going to guess probably on Academy Street since it's so visible in Presque Isle. Why is it important? Well, we offer a variety of services from individual treatment for mental health issues to supports within the community, and we understand the value of, just like what Addy was saying, those partnerships, because we believe that people are best served when they are engaged in their community, when they feel productive within their community, and they feel supported by the people around them. And offering substance use disorder services, mental health treatment, and community support services are part of giving a well-rounded support to people.
And lastly, to both you and to Julia, as our behavioral health professionals on today's guest panel, if someone out there is experiencing what they may think are the blues or just some challenging period of time, the hope of this project is that individuals do reach out for help. What do you encourage people who are maybe going through a difficult time right now to do?
Whatever is easiest for them.
Well, like you said, Jason, I think
Oh, well, we'll start with Jen and then we'll go back to you, Julia.
Sorry about that, Julia. I would say you can do anything from go to
Right.
speak to your doctor about a recommendation of a provider that they work closely with. You can certainly just get online and do a Google search, and you'll get any number of community mental health professionals. Of course, I'm going to plug the Northern Lighthouse and say you can go to the Northern Lighthouse, TNLH.org, and do a referral or call us up. But we all try to make it, any community mental health agency I know, they do a really great job of trying to make it as easy as possible to get in and get an assessment for some recommendations on what might be best for you.
Great. And Julia, your advice?
I would piggyback what Jen is saying as far as just picking up that phone and, reaching out to one of the mental health agencies, or, even, if you have a friend that, you are able to talk with, even just sharing that may then open the door for them to encourage you to reach out to one of our providers. And the Google search is always a good thing to do as well, if you just really don't know where to go. We also have the Pathfinder that, is something that ACAP has sponsored with United Way, that has those resources available too, that's online or in a paperback form that many agencies have as available too. But first of all, just reach out, talk to somebody and let them know how you're thinking and feeling. And then hopefully you can then get the supports that you need.
And the last word, Don Roberts is the one of the lead organizers of the Yellow Tulip Project. What are you looking forward to about this week, and perhaps even next spring when those yellow tulips start to pop up?
Well, I think it's just going to be great that we're all coordinating together to get these gardens all over Aroostook County. There has been some gardens up in Van Buren, Fort Kent area, but none in the central part of Aroostook County. So I think it's going to be great that we're going to have some here now to represent the county. And I know the Yellow Tulip Project is very excited about our project, so that's good. And if you take any pictures or anything, hashtag them, hashtag Yellow Tulip Project or hashtag Smash the Stigma, and they'll go right to their website, so they'll know that what we're doing up here in Aroostook County.
Great. Well, Dawn and Addy, thank you so much for your efforts to bring this project to light here in Aroostook County and to life here in Aroostook County. And to our behavioral health professionals, Julia and Jen, for joining us on this week's ACAP Today. Before we leave you, we all want to remind you that we do ask that you reach out to us if you are in need of any assistance. Even if you are in need of behavioral health assistance, we'll gladly connect you with our partners over at the Northern Lighthouse. If you don't have that number really accessible, please do give us a call and we'll make sure that we make that connection happen for you. Please also feel free to email us at acap-info@acap-me.org if you have a question about any of the services we offer, or just want to know what we might have available for you. We encourage you to connect with us on Facebook. We regularly post there. You can also view our YouTube channel for the Aroostook County Action Program, where you can see past broadcasts of ACAP Today and some wonderful lessons taught by our teachers and prevention specialists. Also, please do connect with us on our new website, acap-me.org. And as we do at the end of each broadcast, we leave you with our snapshot of the week. And today it's a familiar snapshot. It's the ACAP community cupboard outside of our 771 Main Street facility. There are similar cupboards like this throughout Aroostook County that different organizations and businesses have brought up throughout all of Aroostook County, really. This is under the principle of give what you can, take what you need. But the cupboards have been in very high demand since the beginning of the pandemic. This isn't intended to replace the local food pantries, but really to augment in the event that somebody needs something and is food insecure at that moment while the pantry is not available or accessible to them. We want to thank the United Way of Aroostook for being our first sponsor of the month, given the additional demand on these food pantries. We are starting a sponsor of the month program, and United Way of Aroostook signed up as the very first sponsor of the month for our community covered sponsor of the month program. Thank you to the United Way, and thank you to all of our community members who drop off food in this pantry and others on a regular basis. You are making a difference by giving what you can so others can take what they need. And so on behalf of our four guests today and on behalf of everyone at the Aroostook County Action Program, I'm Jason Parent, wishing you all a great rest of your week. We'll see you next week with another edition of ACAP Today.